Friends, welcome to my workplace at Ranaghat, West Bengal, India. Let us observe this totally unedited surgery start to end. The ocular surface is thoroughly irrigated with BSS, applying few drops of povidone iodine. And now the main incision is to be made. A 2.8 millimeter steel keratome is taken. A main incision is made at mid-limbus, including some capillaries. If you include some capillaries, healing is faster and much stronger. The anterior chamber is filled up with 2% HPMC. A side port is made on the left side of the main wound. You can make the side port first and then the main wound, that is up to you. I find this is faster. And now I make the Capsulorhexis with Oertli forceps. Size of the rhexis is about 5.5 millimeter. And now hydro dissection is done with 27 gauge cannula and a 2 cc syringe with BSS. The nucleus is tapped. Antechamber again fills up with viscoelastic substance. And now watch direct vertical chop. The phaco needle goes in with its bevel down. Some superficial cortical lens matter is removed. The tip is buried in the substance of the nucleus. A strong hold is achieved and the nucleus is chopped into pieces. To hold strongly, you occlude the tip completely. That happens if you bury the tip deep into the substance of the nucleus, applying ultrasound, and then be in position 2, that is only aspiration and irrigation, and keep this strong hold and then chop. All the pieces are emulsified. I am in during emulsification of the last piece, I decrease the parameters, and in that parameter I remove the cortex also in many cases. Most of the cortex can be removed by hand piece, but if you think this is dangerous in your hands, please use safer options. And now hydroimplantation of an intraocular lens. Hydroimplantation means you keep the anterior chamber maintained by irrigation, that is the irrigating probe or bimanual IA. This is the irrigating probe. Just a bit of polishing only by the irrigation, no aspiration. Just dislodging the cells on the posterior capsule, turning the irrigation needle. The main wound is enlarged by 0.2 millimeter, and a B cartridge is used to implant an intraocular lens. B cartridge causes less compression of the intraocular lens. Here goes a beautiful lens from Johnson & Johnson. It is Technis 1. No financial interest, but we must mention that this lens has got beautiful material. I haven't seen glistening in this lens in my practice. This is moxifloxacin. The side port is closed by corneal stromal hydration. And then a final lavage is done to remove the viscoelastic substance that sticks to the corneal endothelium, and this can be achieved by a Simcoe. A gentle stream of BSS is directed towards the corneal endothelium and it is removed. The antechamber is nicely formed. And now don't conclude without checking the wounds. There should not be any leakage from any wound. check the integrity of the wounds with a. In this case, I thought the antechamber is not nicely formed, so I used the irrigating probe to put some more BSS through the side port. Now I check the wounds and conclude the case. Thank you very much for your attention. Hope this video will help you in developing your surgical skills. Please learn direct vertical chop and do surgery with joy.